Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton back with us in studio.
This morning he's focusing on healthcare tips for the election.
Yeah, absolutely. It's upon us now. As you heard earlier, today is the last day to get your absentee ballot filed in terms of requesting. Our in-person excused voting starts tomorrow. So make sure you know when and where you need to be based on getting your vote cast, because every vote counts, and this is your chance to have a voice in our elections. And we're talking about how healthcare can impact that as well. This election will make a huge difference with regard to health care. Both candidates talking about how they believe they can impact and decrease the cost of health care. Well, here are some tips from the inside, some things. If you're listening, Ms. Harris and Mr. Trump, here's some things that you can talk about. Focus on the quality, not futility. We here in the United States spend a ton of money on futile care. That meaning care that doesn't impact the overall wellness or longevity of our patients. Making sure that we focus our monies on quality. This includes pediatrics. A lot of money doesn't go towards pediatrics. We need to make sure we're focusing on that quality over futility. Decrease defensive medicine. We have a lot of medicine that's performed in this country that is defend against lawyers, not to help the patient. Making sure that in this medical legal environment, with Kentucky being one of the worst in the United States, making sure that we are allowed to practice medicine, not defensive medicine. Address medication costs. This is important. We have the highest medication costs in the world, and there are a lot of reasons for that. Some of that is direct to consumer advertising. When you see an ad on TV for a drug, it's not a cheap drug. They are not advertising generic drugs on TV. PBMs, other areas, things that you may need to do to make sure that the medication costs are down. We can do that. We can drop these costs and make it more affordable for people. And finally, put more dollars towards actual care. I mentioned earlier, 17% of all dollars in the United States go towards health care, and less than 20% of that actually goes towards those providing the care. We've had a huge explosion in the administration of health care and the things outside of health care. We need to focus on actually providing health care, and that's that physician-patient relationship or provider-patient relationship. That is where the focus needs to be, and making sure we're actually putting those healthcare dollars to work.
It's been well documented. Immigration and abortion are probably the two biggest issues in this presidential election. Where does this healthcare talk rank?
It's always right there, just right under. Economy consistently tends to be the highest driver, and then those issues as well. Of course, the abortion and women's health will fall under the healthcare side of things as well. Healthcare is one of the top 2 or 3 things that are on voters' minds right now, as it should be.
All right, Doc, thanks so much for the timely topic. We appreciate it.
And we'll see you guys back here Thursday.
Nice.
Can't wait. We'll be right back to the final hour of a newscast.
That's a break. This week.
Boom.